They say all children have a right to education, but for us it's not fair because if we need to travel so far to be at school. Meanwhile, a normal child can just walk past the road to get to school. Maybe I can just stay with him at home, but it was highly impossible because he wanted school so much. It's so devastating as a mother to see your child at home not going to school. It's like, it's bad, it's bad.
According to one parent, having a child with a disability uncovers strength and abilities in you that you never knew you had. It is estimated that autism affects at least 1% of the population of all ages worldwide. While the World Health Organization has recognized ASD as a global public health priority, in South Africa, there's little awareness about this condition. Only 10% of people living with autism are correctly diagnosed. Now, World Autism Awareness Day is an internationally recognized day and celebrated on the 2nd of April. Now, the theme for 2019 is Assistive Technologies, Active Participation. Now, this is focused at highlighting access to affordable assistive technologies as a prerequisite for those with ASD to exercise their human rights and participate fully in the life of their communities. Now, I'll be joined in studio by a pediatrician, an occupational therapist, National Director of Autism South Africa, an autistic adult, a parent of a child with ASD, and 2 parents of young adults with ASD. And all these will share their story with us on the impact that they have on, or at least the impact on a parent raising a child with ASD. Now, be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this Bamba show coming to you just after a short break. I'm Dr. Selom Mutaung, and this is Health Talk.
On Trains Travel, we bring you a full guide on all things lifestyle related. With so much to discover, we give you comprehensive reviews of places to visit, music, travel, and food. We also explore the arts, whether on or off stage. All this and more, be sure to tune into Trains Travel, Saturdays at 5:30 p.m.
Yo, Leroy!
Maziwe. We keep it smooth.
Mama, you know I love you. You know I love you.
Hip-hop, the whole hip-hop culture.
A flip mode squad is dangerous.
Where you getting down with Spinderella and everything is Jeff. Don't worry about a thing.
International music. Local is lekker. Hey when Studio Mix DSTV channel 156 on SABC Encore.
Every day, Phumzile and her son Mxolisi wake up at 4:30 in the morning before making the long 4-hour trip to get him to school. Mxolisi was born with autism, a disease that affects brain development and behavior. There are many schools much closer to them, but none cater to his special needs.
They say all children have a right to education, but for us it's not fair because if we need to travel so far to be at school. Meanwhile, a normal child can just walk past the road to get to school. But with us, you need to travel with trains, travel with taxis. It's like a mission to get him at school.
It's hard work, but Phumzile is simply grateful that he's in school at all. It's estimated that 500,000 disabled children across South Africa can't access their constitutional right to education.
I thought to myself, maybe I can just stay with him at home, but it was highly impossible because he wanted school so much. He will tell you, Mommy, school. I was so sad. It was so disappointing of me as a mother, playing a role, being a mother to Mkolisi, and then didn't know how to cater that for him. Yeah, it was highly sad. I felt like the system has forgotten him. The government has forgotten him. That means our children, they are not children to them. They appear as something else because of every time when they build a new school, it would be a mainstream school, not a special school. That means they have forgotten about our children. But it's so devastating as a mother to see your child at home not going to school. It's like, it's bad, it's bad.
Phumzile struggled for 5 years, trying 8 different schools along the way, until she was finally able to get him into a well-resourced school that's equipped to teach autistic learners. And it's already making a huge difference for both of them.
Since he has been to school, he has changed a lot. His behavior has changed a lot. When it comes to computers and digital things, the gadgets, he's so brilliant in those things. Even with me, if I have a problem with my cell phone, I will ask him, can you please help me with this? And then he will be like helping. So you can see he's got potential. He can't write, he can't use a pen to write, but he can type. And we were like, amazing, getting the spelling right, everything right in order because of his using the digital things. It was so lovely for me, for him to be at school, and for me as a mother to know that I have achieved something for him. I have achieved the biggest thing, which is education.
All right, so we're going to learn more about this autism from our special guest. Let me start by introducing the lady on my extreme left, Dr. Izara Rubero, who is a specialist pediatrician based out in Pretoria. Welcome to Health Talk, Dr. Rubero.
Thank you so much.
All right. She's struggling a bit with her voice, but I'm sure we'll get that right. And of course, close to me is Sandy Klopper. Sandy is the National Director of Autism South Africa. Welcome to Health Talk, Sandy.
Thank you so much for the invitation.
All right. Perhaps let's start with you, Dr. Rubero, just to test your voice out, and make sure that everybody can hear you. We're talking autism here, and we hear there's autism spectrum disorders. Please just take us through what is it that we're talking about and which is the terminology that is correct, as it were.
So, autism spectrum disorder is a developmental disorder that affects a child or a person's communication, social interaction, and behavior. In the past, there used to be separate diagnosis of autism, Asperger's, and Rett's. What recently happened a couple of years ago, we've now made it a branch term and refer to it as a spectrum. The reason for the spectrum is that every child is different, or every person is different. Different severity of affecting them socially, emotionally. So that's why we now refer to it as a spectrum, just because there's so much diversity when it comes to the people with the spectrum.
So it's not one condition, as it were?
It's not one condition. It's a spectrum of conditions. It's a variety, because with every autistic person, there's different challenges, whether it is more of a social, in terms of their repetitive behaviors. Because with these kids, in terms of their behavior, you've got restrictive patterns of behavior, things that they do concurrently again, sequencing, flipping of objects, certain words that they say. And then the other component is their interests. So in terms of the intensity that it affects the patient or the person, also determines where on the spectrum they are and the challenges they face.
All right. We're gonna come back later to that, because I would imagine people watching this show would say, okay, so how do I recognize that my child might be having this? To say what are those things that people should look out for. But Sandy, let's talk about how common this condition is. I mean, autism South Africa. Perhaps let's start there.
Okay.
What is Autism South Africa?
So we are a national organization with affiliates throughout the country, and really work to try and improve the lives of individuals with autism across the country. We focus a lot on training
professionals and parents especially, empowering those parents in order to provide the best opportunities for their children. And we do a lot of advocacy and lobbying work throughout the country just to ensure that people with autism rights are really realized across South Africa.
Okay. We said that, I mean, obviously it affects 1% of the population throughout the world of all ages. But in my introduction I said that awareness in this country in particular is a little low. How far true is that?
It's very true. And we, you know, the 1% is actually a guess because we haven't done any prevalence studies in South Africa because there is such a stigma that surrounds autism. So families often hide their children away, or doctors that they go to for help don't understand the condition at all, so they never get diagnosed. So we don't actually know. But there's no reason to believe that it's any higher or lower than anywhere else in the world. So we go on the international prevalence studies of 1 in every 59 it is now.
So I would imagine there's lots of myths then around the condition linked to the poor level of awareness, yeah?
Absolutely. Myths like, you know, it's something that you've done, or the mom had an affair while she was pregnant or during the marriage, and now this has resulted in this child, or demon possession, or a big one is this child is just very naughty and you need to discipline your child, and what about a big hiding? That's going to help. And that's the sort of stigma that our families face on a daily basis. Catching the bus, transport, everything is an issue for them.
Talking about naughty now, you know, it's about behavior. Let's come back to what we spoke about earlier, about the symptoms. I'm not so sure that we can talk about typical symptoms, but what are those things that parents should be looking out for that might indicate that there's something that needs attention, yeah?
They say, well, you can detect it already from about before the age of 2. There's certain, what we refer to as red flags, things that will make a parent notice that there is something wrong. Things like a speech delay is generally the first thing. Poor eye contact. It doesn't always mean that people with autism don't make eye contact. It's inappropriate eye contact. Parents will feel like they're talking to their child, but their child might seem deaf, like they're having difficulty in hearing them, responding to their name. So those are early signs. Other things are particular behaviors that they have. When they're playing in a group of kids, they will do what we call parallel play. So they will be interested in what the kids might be doing, but not in the children themselves. So they'll play next to them. They have difficulty in making friends. So the social interaction varies as well in severity. And then we have things that are more stereotypical behaviors that we see with autism. And these are things like where they would repeat the same phrases, speak in a gibberish, their own language. They have sequencing. Parents will notice that they pack everything in little rows or flip things around, sorting them. So that's more of your stereotypical behaviors in terms of that. And then they're very strict with their routine. A lot of the time they don't like to try new foods. So parents will say they're picky eaters. They don't like to try new foods or go to different places. They like their routine done. So those are things parents might pick up. The other thing is certain interest in certain things, perhaps in dinosaurs or a particular toy that they won't be separated from. Different kids, for instance, might pick a particular shape like a heart, and everything needs to be associated with that. Or dinosaurs, for instance, they'll be able to give you all the knowledge about that, but it's very restrictive. Water, for instance. And the other thing is the sensory. These kids, we get what we call hyper and hyposensitive kids. Things like light, noises, very loud noises. Parents will go into a shop and a child might, what we say, freak out a little bit. They'll close their ears, go sit under a cupboard, run away from the loud noises. So these are kids that are very sensitive to that. They touch certain textures on the skin, textures in the mouth. Those are your hypersensitive kids. And then you get the different type of kids that will stick things in their mouth. They have a low pain tolerance, so they might run into cupboards, or when they bump themselves, they might not notice that they've hurt themselves. So these are all little things, but the severity range depending on the child.
Well, I'm glad you said these are all little things, because almost all of those things that you described, I'm sure some parent might have noticed exactly the same in their kids. But that doesn't obviously necessarily mean that this is ASD.
No, not at all.
So what would be the cutoff point? Would it be at a point where it begins to worry the parent?
Definitely. I think nobody knows their child better than a parent.
Yeah.
And a parent has that gut feel. And when you have that gut feel, go to the doctors.
Right.
According to the American Academy of Pediatrics, they say we should be screening for autism at 18 months and 24 months when these signs come. So if you feel that it starts impairing them socially, affecting their home functioning, their school functioning, making friends, the teachers complain and say your child is unruly, he keeps running out of class, he doesn't sit still, he's aggressive with the other kids. These are signs that a parent should perhaps go and see a pediatrician or go to their local clinic to someone to assess the child and look further.
I'll tell you what, time for a quick break. When we come back, we'll continue our discussion on ASD. Please stay with us.
Years go by and new faces are born. New villains and new drama queens. We look back and reflect on the memories that serve us. A tight bond molding us together, creating stories that will last forever. Make your evenings memorable. Weekdays on SABC 1. Mzansi for sure.
We were there at the birth of a new nation. We are here today as her democracy matures. An impartial and independent witness to history. SABC News, always there when South Africa decides.
South Africa has the highest rate of new HIV infections in the world. Pre-exposure prophylaxis, known as PrEP, has been shown to be 90% effective in preventing infections. Although it has been
Okay, welcome back. So let's learn about challenges and joys of raising a child with ASD from our guests. We still have Sandy Klopper, who's the National Director of Autism South Africa, and we're now joined by two other special guests. First, let me introduce Desiree Pile, who's on my extreme left, who's a parent of a young adult with ASD. Welcome to Health Talk, Desiree.
Thank you very much, Doctor.
Right. And then, of course, in the middle, we have Faith Ndaba, who is who is a parent of a child with ASD. Welcome to Health Talk, Faith.
Thank you, sir.
All right. I'm going to come back to you, but Sandy, you know, we couldn't talk about causes and risk factors. How much do you know about them?
I wish there was an easy answer to that, but the truth is we just don't know. We don't know what the cause is, and we don't know what risk factors there are. There's a lot of money being put into research about the causes. We suspect there's some kind of a genetic component and environmental triggers, but we don't know.
Yeah, all right. Let's take Lamis on the line from Cape Town. Lamis, welcome.
Hi.
Hello, Lamis.
How are you?
We're good. How are you?
Good. Thanks for asking.
Mm-hmm. You have a question or comment?
Yes, I do.
Right.
So I have my daughter's 6 years old.
Right.
But I think this has been going on since she was about 4. There is certain underwears that she wants to wear. There's certain pajamas that she wants to wear. I have to literally brush her hair 4 to 5 times a day because she feels as if her hair is untidy.
Right.
I want to know if that is sensory disorder, if it falls into that category.
All right. And you're obviously uncomfortable about that.
Very. Like,
all right.
Yeah.
Yeah. Okay. So let's give it to Sandy. Sandy, what should she do?
So what I would say is trust your gut, and if it's really affecting her functioning on a daily basis, then go and consult somebody. From what Mom is describing there, the first person I would actually go and consult is an occupational therapist.
Right.
Because it seems to, from the sounds of it, it's like sensory, especially with her hair and the texture of the clothing. So I think first port of call is an occupational therapist, and then they can make the referrals.
Bottom line is, if she's uncomfortable, she must consult.
Absolutely.
With a professional. Okay, let's start with Desiree. Desiree.
Yes.
You have a young adult.
Yes.
Of how old?
She will be 23 in August.
23. Tell us about your story.
Well, my daughter is Savannah Pillay, and she was only diagnosed when she was 8 years old because her first diagnosis was cerebral palsy.
Yeah.
So we did everything that we were told to do for cerebral palsy. And when she was 8, I was given a book. Just somebody in church lent me a book that they thought was interesting to read. And it was called Simple Simon. And it was a mom's story about her autistic son. And I was reading this book thinking, this is my child, this is my child, this is my child. And yes, phoned Autism South Africa, then had a clinic, and we had the appointment, and she was diagnosed as a person with autism. But I didn't cry. I was actually very grateful because we had started using assistive technology to help her to communicate. And many of the strategies we were using, unbeknown to us, were actually strategies used for people with autism. So it wasn't difficult for me. I just have to say, though, that as our children grow, life changes and we change and the challenges change. And as she's gotten older, the way we've learned to understand that Savannah is autistic, it's how she describes herself, with cerebral palsy and other stuff. And she doesn't appreciate that we are the gold standard. She doesn't see herself as any different, and she accepts herself as she is, which is sometimes a challenge for me, her mom.
So let's go back to when she was 8 years old then. I mean, that's the first time you say you read that book and you saw... So there wasn't anything in particular that was worrying you that at that time to say that I need to take my daughter to a psychologist or doctor or anything?
No, because she had the diagnosis of cerebral palsy, and that's often what happens when there's dual diagnosis. One disability can mask the other. And that's, so there was nothing, I didn't even understand cerebral palsy enough for me to question what fell under that umbrella.
Okay. We'll speak to the doctor later to kind of learn about this association between cerebral palsy and autistic spectrum disorders and other conditions as well. But let's speak to Faith. Faith, you have, I believe, a 6-year-old?
No, a 7-year-old.
7-year-old.
Yes.
Tell us about it. When was your little one diagnosed with autism?
When he was 3.5 years old.
Right.
Yes.
And what did you notice at the time?
At the time, I thought he was just being a naughty kid.
Right.
Yes, so, but it came even more, the behavior, the way he was violent, aggressive. So it was difficult for me to go out with him in the malls because he would run, then we'd go back home without doing any shopping. So it was frustrating for him because he was not talking at the time. He had no speech till at the age of 2 years. He was not talking. Then I told the doctor about this behavior of Yola, that he throws the toys away. He doesn't play with toys like any normal kid would. So the doctor referred me to a OT. So we went for OT. When we got to OT, we did activities that would calm him down, play with clay. But he was not having that because he was so busy. So at some point when we'd go to appointments with him to OTs, they would end up taking me outside because he would just cry all of a sudden, and I would start crying because I wanted to know what was wrong with him at the time. So they will just say, "Mommy, please wait outside. We'll call you when we are done." So I had to go outside. Sometimes I will hear him screaming from outside. So it was so frustrating. Then they took us to a speech therapy. That's when the speech therapy told me that, I see some autism signs in Yola. So she referred us to a neurodevelopmental clinic at Charlotte Matley. So we met this doctor, then we did an ADOX. But even then, they said they won't do the test until Yola is 3 years old. Yes, so we had to wait. So I would lock him inside the house. sometimes when a person comes to knock at the gate, so I have to be aware that Yola would rush off the gate and run away. So we kept the doors.
Had to be looking after him and ensuring that.
Yes, and he was so fast.
Yeah.
Yes, so we went to this neurodevelopmental clinic. Then the doctor told me that Yola has autism. At the time, I didn't know what autism was.
Yeah.
I was confused. What is autism? What is the cause of autism? Did I do something wrong? Is it my fault as a parent? What happened? So I had all of those emotions. Then they transferred me to this social worker at Autism South Africa.
Yeah.
They said she's going to explain to me about autism and help me to get a school.
And then you started learning about autism. We're going to come back to you. Let's speak to Siyabonga on the line, I believe from Johannesburg. Siyabonga, welcome.
Hi, how are you?
We're good, how are you?
I'm all right, thank you. So I have a problem with my daughter. My daughter, she's 3 years old.
Right.
And she can't talk.
She can't talk?
Yes, but she can sing. She can even sing everything that they are doing at the preschool. At the same time, she likes to use the phone. As you were asking the symptoms, she also likes to close the ears. I don't know whether she feels too much noise or what. And we do not have anything that says maybe she's autism, but I have a real problem with that because at her age, she's supposed to have that eye contact with me because I have to raise my voice when I call her so that she can look at me. So I don't know whether I should say maybe this is that autism.
Well, have you taken your child to a doctor at any point?
Yeah, my daughter was down to the vein with the granny, so now she's here with me.
Yeah.
I started to take her to the clinic, then to the clinic they referred me to the hospital. Unfortunately, I have an appointment next week to just take her to the doctor so that maybe we'll find out what's going on with her.
Sandy, I think he's doing it the right way, isn't it?
Absolutely on the right track.
Yeah.
Go and see the doctor and then see what the doctor says.
Yeah.
We can, for other parents that are wondering also, phone our offices and we can refer you to doctors that are in your area.
Right.
Because often what will happen is that parents will go to the doctors, and generally with the little boys, they'll say, don't worry, he's 3 years old, he's going to grow up, he'll talk eventually, and they go away. And there is definitely interventions and therapies that can be started before that diagnosis happens. So definitely, I think, Siyabonga, keep your appointment and go from there.
Well, Desiree Pile, Faith Ndabana, I wish I had a lot more time to speak to you, but unfortunately we've run out of time. Thank you very much for participating in our show. Time for another quick break. When we come back, continue our discussion, focusing this time around on treatment. Please stay with us.
Time is the definitive show that brings you the lowdown on cinema. Music. Arts.
Recently, 50 makeup artists from around the country watched their art pieces grace the stage in the annual Fantasia body painting competition held in Johannesburg. The results quite revealing.
And sport.
Drop and goal is good, hits the post. Heller goes himself, and it will score. Oh, what a try! Magnificent play from the Australian 5'8".
Catch prime time on SABC Encore, DSTV channel 156, timeless.
A royal welcome, please, for a regal southern songstress, Yvonne Chaka Chaka.
When everybody wanted to be doctors and nurses, I stood up and I said I want to be white.
Oh.
The late Joe Slovo called me the Jewish Zulu.
I think it's very sad these days, for a long while, that a lot of women
blame this on the guys, because this is a plot by the women against the women.
We are socialists. Yes, sure. All of us.
Be intrigued by hitting topics on the couch with people of the South and stay cultivated as they grace you with cultural entertainment at its level best on stage. Make a date with Dali Tambo as he profiles everyone from all walks of life on SABC Encore, DSTV channel 156.
This is the SABC News Channel, independent and impartial.
When news happens around the world, we will bring it to you. We will keep you informed. Each day, every day, our news team digs deeper, getting all the facts to provide comprehensive reports to what's important to you. We cover all corners of the globe. SABC News, independent and impartial.
Okay, welcome back and thank you so much for staying with us. If you've just joined us, we're talking autism spectrum disorders. We have a panel of special guests. The lady in the middle is Dr. Isara Ribeiro, who's a specialist pediatrician with special interest in autism spectrum disorders. And then closest to me, we have Jackie Patterson, who is an occupational therapist, also with special interest in ASD. Welcome to Health Talk.
Thank
Jackie.
you. Thanks.
Okay. Then, of course, we then have Melt Olkers, who is an autistic adult. Welcome to Health Talk, Melt.
Thank you.
All right. Before we have our discussion, let's take Estelle on the line from Bloemfontein. Estelle, welcome.
Good morning, Doctor. How are you?
We're good. How are you?
No complaints. Doctor, I have a quick question.
Right.
I know a little, I think he's about 7 years old. Yesterday I was watching Expresso, and Dr. Green also talked about autism.
Yeah.
But they didn't put my call through because there wasn't enough time.
Right.
I would like to know, how does autism develop? And Dr. Green and the expert that was next to him explained that most of the children that has autism are scareish of people. But every time this little one sees me, he gets overexcited and he leaves his mom's side.
Okay. All right.
To give me a hug.
Okay. Okay, Estelle. I think we'll get the gist of it, and we'll get Dr. Ribeiro to see if she can. I'm seeing some of the stuff you have already touched on. Perhaps you just want to quickly respond, yeah?
So I think of the causes we've dealt with that we don't know what causes it. Autistic kids are capable of love. People think when you think of autism, you think of a child that can't be affectionate, that stays within themselves, but they are. The thing is, the problem with autism, or what we notice with autism, is that their social interactions might be inappropriate. They might be over-friendly. They bolt out the door. They do have stranger anxiety. Yeah. They're capable of that affection. So just because they do make contact with people, it's about the non-verbal communication. It's the body language. How do I read someone's emotions? Yeah. Can I recognize sad? Do I know what to do with it? So it's more complex than just a child who won't engage with someone. Autistic kids are very affectionate and very loving. It's just the way in which they bring that forth might sometimes be a little bit.
Melt, I want to talk to you now because I'd like, I'm interested in knowing your personal journey with autism. But before that, we're going to take Homolima on the line from Pretoria. Homolima, welcome.
Hello, hi. You're speaking to Homolima.
Hi.
Yes, I just have a question. I have an autistic daughter. She's 4 years old.
Yes.
So I'm just wondering, is there ever a case where a child can be misdiagnosed because of the symptoms that she had? Because when she was younger, she had problems with communication, her behavior, repetitive behavior, and social interaction. She couldn't interact with other children at all. Yeah. But now, 2 years later, she interacts perfectly with other children. She's very affectionate. The only problem we're sitting with now is the communication. She's struggling to put sentences together. She just has a few words, though.
Very interesting question.
The language.
Yeah. All right. Khomelima, thank you so much for that question. It's an excellent one. Perhaps let's give it back to Dr. Ribeiro.
So yes, it is possible. Autism is a very complex disorder. it is like Sandy was saying, we're learning so much more about it now. There's more awareness, we're seeing more.
Yeah.
So sometimes kids, when they have the correct intervention early on, they sometimes what we call is they fall off the spectrum.
Yeah.
They are higher functioning. It could have been that she had a dyspraxia, and it was more of a social problem, a communication thing that's now improved,
But what
and therefore
must
symptoms
she do
improved.
now?
So the thing is, it's important to remember that the diagnosis of autism isn't there to limit you as a child. It's a stepping stone. It's to empower us in order to get the treatment so she can go back and have it reassessed and have an assessment done again and see whether there's a different diagnosis.
Okay. All right. Before we run out of time, I need to speak to Melt. Melt, I'm interested in your story. You've been living with... Well, maybe it's not the right thing to say you're living with ASD. You're an autistic
adult.
Right? Tell us your story.
Actually started when I was small. My parents were very active in the church, visited people a lot. And I used to steal all the teaspoons.
Like most boys do, isn't it?
And my mother always had a handbag full of teaspoons, going to the people to ask them which ones are yours. And even at some stage, running out of the house, going to the neighbors and ask them for tea.
Okay,
you know, I'm going to visit. No, to visit, you know, like my parents did.
Right.
And there was behavioral problems, speech problems. At school I saw a speech therapist, and even at stage that some teachers wanted to place me in a remedial school. Took me out of the class one day where I had to build the blocks and everything and that, and went to school psychologist and two more school psychologists and then more school psychologists. One of the psychologists said they were wasting his time. There was nothing wrong with me. And I had an incident at work where I had a meltdown, and after that I accidentally read an article about autism and made an appointment with a psychiatrist. I was diagnosed with Asperger's syndrome, as it was known that time. It's now incorporated with autism spectrum disorder.
How old were you then?
I was in my 30s, I think 32.
Okay.
Very
so
late.
it's quite a late diagnosis.
Very late diagnosis, and it's quite often that you will find it with people of my age who are diagnosed very late.
Yeah.
Some even diagnosed when their children are diagnosed, then they themselves realize that they are on the spectrum. And I decided...
So where are you now? I mean, are you undergoing any form of therapy?
I'm undergoing therapy. I see psychiatrists, psychologists. I do use medication for anxiety and depression. Treated for post-traumatic stress due to bullying at school and so on. Longer, you know, things that just go on and that. And as well as I had cognitive behavior therapy, something that I constantly do myself by reading more about how to deal with people.
Okay. All right. So before we speak to, no, I mean we've had you here. We haven't even spoken to you. But let's take Patricia on the line from Soweto quickly. Patricia, welcome.
Hello, Doctor. My name is Patricia.
Yes.
My phone in connection with my grandson. He's a CP child. And then on the system and I've screaming and shy. Lumi is spoon mom fita. And as it is that thing, it costs autism normally.
How old? 6 years?
Una 13 now.
13.
He was, what the major is bedridden. He brain.
Oh, I see. Okay. All right. Okay. Thank you for the question. So she has a 30-year-old grandchild who oftentimes, she had, I think, cerebral palsy. That's what it sounds like. But she's got certain behaviors that, when fed, she would, cling on the teaspoon, with his teeth, and sometimes become violent and so on. And Granny would like to know whether or not this is autism, seeing that we're talking about this, or is it something else, or is it rather, effect of the cerebral palsy?
It could could be part of the cerebral palsy, as it in the cerebral palsy has an effect on the development in the brain.
Yeah.
So in that instance, I would take her when she goes for her follow-up visits, which she should be doing, for the doctor to assess and for her to raise her concerns and say, this is what she's seen, this is what she heard, is this a possibility? Because autism has got many comorbidities. So it's not something that causes autism. But as Mel said today, you've got anxiety, you get depression, you get attention deficit disorder. Kids have gastrointestinal problems, they get sleep problems. So there's a multitude of things that coexist together. So I would suggest that she goes on a follow-up and raise those concerns with her doctors.
Jackie, let's give the last question to you. Principles of treatment. As an OT, I mean, you get involved quite early on in treating children with ASD. Just take us through the principles of what you do.
Yes, so we believe in early intervention because then you can help the child to adapt and to learn and to change and develop. As occupational therapists, we mainly look at the sensory system and the sensory portion. Although we take a holistic view of treatment, our role mainly falls within the hypo or hypersensitivity of the child. 95% of children with autism have sensory processing disorder, but you can have sensory processing disorder without having autism. So what we look at is helping the individual, the child with autism, to cope with the incoming information, to process the information, to regulate themselves. Because self-regulation is one of the important skills in early development. And if you can't be regulated, you can't get to expressing yourself. You can't get to processing information, understanding what people are saying to you, and being able to respond and being able to learn, and that affects development.
So where do you get the patients from, as it were? I mean, oftentimes you hear that schools would refer children to OTs. Sometimes I don't know how much you get from other doctors out there, GPs and so on. How do you get these people coming to you?
So sometimes I get children referred to me that are suspected to be on the autistic spectrum. And then I work on interventions that help children with autism because I can see the features, whether they are on the spectrum or not. The interventions help helping with the sensory modulation, helping with engagement, helping with daily living activities. These things are important for children to develop anyway. And I get children that are referred when they have behavior problems. Sometimes with communication problems when I work with the speech therapist. But generally with behavior problems, with concentration problems, children not engaging in the classroom. Teachers
I think we need to talk a little more about what is it that we do for these kids to help them integrate into society and normal schooling like anybody else. Well, that after a quick break. Please stay with us.
When you put 5 girls against 5 guys, of course it's going to be lit.
Andile, what's the next challenge?
Witness all the fun, tension and laughs as we see how well friends know each other to win a luxury cruise. Join us as we bring the excitement every weekend at 6 p.m. only on SABC 1, Mzansi for sure.
South Africa decides.
Raise 290 billion rand.
An African perspective this week. We discuss the foreign policies of the main political parties in the country.
On the 8th of May, when we vote his government out of this town.
From Cairo to Cape Town, Madagascar to Morocco, we are one thing.
join us on Wednesday at 9:30 p.m. on SABC News.
Welcome back. We continue our discussion on ASD with our guest, Dr. Isara Ribeiro, who's a pediatrician, Jackie Patterson, an occupational therapist, and we're now joined by Phumzile Vilakazi, who's a parent of a young adult with ASD. Now, you may have noticed that earlier on we played a clip showing a lady that had difficulties with her child getting access to schools and so on, and this is the very lady. Welcome to Health Talk.
Thank you so much, Doctor.
All right, we're going to hear about what happened from that time till now. Right. But let's start with you, Dr. Ribeiro. Just the principles of treatment from a medical perspective. What do doctors like you do to treat ASD?
So the starting point is to remember to look at the child as a whole, to see where are his or her biggest needs. So when as a doctor, there's medical treatment, there's medication, which helps with the agitation, the anxiety, the hyperactivity. But it doesn't stop there. Yeah. There's so much more because the child is integrated within a family. So my management expresses, and most doctors go towards the parents, mom support. Where's mom support features? How's mom coping? Or is the child's biggest need a sensory problem? Referring them to an OT, but touching base at the same time. Speech therapy. Important is school, because as mentioned before, the diagnosis itself shouldn't limit early intervention. The earlier we intervene, the more intense our intervention is, the more support we give, the better the outcomes are for these kids. We tell parents that diagnosis isn't supposed to limit them. We don't know where the child will end up. But it's important to constantly look as the child as a whole. Medication's role, yes, definitely, in helping them with the anxiety, the emotions, but looking at the different allies and support structures that help with the management of a patient. And that's very important.
Right. Okay, let's speak to Phumzile now. Phumzile, as I said, we played that clip, that was taken a couple of years ago. And tell us your story with your child. I mean, you obviously have gone through quite a bit. Do you want to share that with us?
Yes. On that clip, I think it was 5 years back, Jackie, if I'm not mistaken. I struggled taking him to school every day from south of Johannesburg to Johannesburg every day. So eventually I managed to keep, remember they go with the routines. So I followed the routine, taking him to school every day, and he was doing great at school. But now the other development problems now that we have developed, because of now he's an 18-year-old, and now he's out of school because of some circumstances. He's out of school. I can't find a placement for him. I can't find a right environment for him. Remember, as I mentioned before, that he is a genius. I know his capability. I know he can do so much. But with the environment, it's making him more disabled now because if he can't get what he needs for his disability. So I'm struggling a lot again. I'm back to square one. Remember, I had achieved so many things, but now it seems like I'm going back to where I was before. So that's a struggle for me.
But are there places that can help Phumzile? Jackie?
There are places in South Africa, but they're limited, especially for teens and adults with people with ASD. We're trying to set up more and more, and I know Autism South Africa is very involved in this. But what they've been looking at initially has been early intervention, and now the focus is slowly shifting towards adults. Where can they go? Are there work placements? Are there places of shelter? Where can these teenagers and adults go, and what help do they need?
And I suppose, I mean, it's a difficult one, isn't it? So, I mean, are these places of shelter mainly in the private sector that requires a bit of money? Or?
We do have a lot. There's a lot more coming up in the private sector. There are new and upcoming places within the public sector, but very few, and they're very scattered. So access is very limited. Like Mzile's problem was getting her child from the south into town. It's the transport. It's making sure that they're safe, because if the environment is conducive, they're able to achieve more. So access to these things are very limited. There's a lot more up and coming in the public sector. The people are our public sector is very overwhelmed at the moment because the knowledge of autism is growing. The spectrum diagnosis is broader now. So we're making more of these diagnoses. These are coming forward, but we're not coping with what are we doing with them now? How can we help them? Like Jackie said, early intervention, we get them to this point where they can be a little bit more self-sufficient. But then what? And I think that's the biggest question a parent has is, if something happens to me, what's going to happen to my child? And I think that's where we're lacking at the moment.
So just remind us again, how old is the child now?
He's 18 now.
18.
He's 18.
And what does he do, like, when you hear, where is he?
He was admitted at hospital last week, Wednesday. Because he was violent now. He was hitting people, he was taking people things by force. Remember, he's used to this environment of schooling, and now he's no longer at school. I think that frustrated him more, and now he started changing the behavior, hitting people, windows, breaking windows and stuff like that. So I went to the hospital and asked them if they can admit, and by then it was so difficult for them to admit because of there are no space for children with autism again. They needed to come up with a plan where to put him and stuff like that. But I'm glad that they did finally admitted him to hospital.
Well, Phumzile was lucky. I mean, we read the other day in the papers of a mother who was struggling with her child, who had to actually chain her child in a house and leave for work. And basically come back. Do you know about the story?
Actually, it was me on that paper.
Was it you?
Yes.
Coincidence. What a coincidence. Yes.
So I make sure that I fight for what I believe in. I believe my child has a right to be safe. I believe my child has a right to safety. As we are saying, we know our rights. We need to practice our rights. We need to speak out our minds. So I believe that my son has a right to live too, has a right to safe environment. But if that it doesn't come to me, then I need to fight. So us fighting was to go on that paper to say, here I am. I've been going through all the organizations that I know. I've been going through all the people that know about autism, asking for advice, asking for people to come up and help me, telling people, here is my story, telling the doctors, here is my story. The doctors were trying to help. They did the medication. They tried to prescribe more of the medication that will calm him down, but it didn't work. So finally, I was like, no, but this is enough, because of now I have spoken to everyone who is everyone here, but no one listened to me. So finally I did what I did.
Just in the last few seconds, I mean, there's many other parents like Phumzile, perhaps with younger children. Just in 30 seconds, what more can be done to give support to such parents? Each of you.
The community understanding what the parents are going through and kind of accepting that these children are not naughty. They have a difficulty and they need to be supported to show their strengths. Supporting the schooling and supporting the adults with autism, understanding that they are not they are not different human beings wanting different things. They want the same as we do, but their needs are slightly different.
Supporting the parents?
Supporting the parents is a big thing, and knowledge and acknowledging that people with ASD might be different, but they're still people. They still feel, and they still do have a place that they belong. And it's by having an understanding and not being judgmental when you see a mom with a child who's having a meltdown. Rather be empathetic and don't be judgmental. For the communities to understand that these are not people who mean to do harm, but to be supportive.
That's where we're going to have to leave it. Dr. Isara Ribeiro, Jackie Pedersen, and Pumble Vilagazi, thank you so much for your time. And to you folk at home, thank you so much for watching. And that's all the time we have for our show today. And we're back on the screens again next time, next week, same time, same place. And until then, do take care.